This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast, brought to you by Atrium Health, Wake Forest Baptist. I'm Justin Gomez here with Atrium Health, Wake Forest Baptist, and needed to talk with someone today, and I love having our guest back to talk about just very important topic. Probably lots of people that would be listening to this episode were aware or heard on the news or possibly affected somehow about the recent school shooting here in Winston-Salem, North Carolina at Mount Tabor High School. And this past week, post the school shooting, there's been a lot of questions, a lot of angst, a lot of people not knowing what to do or how to process their thoughts or feelings. And so we're bringing in Dr. Linda Nicolotti to join in us. Welcome, Dr. Nicolotti. How are you?
I'm doing okay, Justin. Thanks for having me on today.
No, yeah, absolutely. Thank you. I know you've been busy and talking with different groups this week, and it's been a heavy week in our community, but I think there's, just for me, at least personally, there's been a sense of hope the way the community has rallied and come together to support, not only the Mount Tabor community, but the school, the kids in our school system overall. So I think that's a bit encouraging. So, just before we start, we're going to dive in. We have a lot of really good questions to dissect, and you're going to help us, get a better grasp and understanding of how to process this and really an important aspect, how to talk with our kids if we have school-age kids here around this area, how to help identify what they might be going through and helping them. But just to recap, Dr. Nicolotti, she's been with us before on previous Best Health podcasts. She is an assistant professor here, and she's the section head for Pediatric Psychology and Behavioral Health. So Dr. Nicolotti, just real quick, remind us how long you've been here in this area and at Atrium Health, Wake Forest Baptist.
Yeah, well, I've been in the area almost about 17 years in Winston-Salem, and I've been at Atrium Health, Wake Forest Baptist for over 7 years.
Gotcha. Well, thank you once again. And we could probably, there's probably hours and hours we could talk about this, but we'll try and keep it relatively concise for our listening audience on the podcast. Just to start off with, there's layers of how people might have been affected, be it by this school shooting, this traumatic event that's taken place in our community. Obviously our hearts go out to the family of the student that was killed. Definitely our thoughts and prayers. That's, obviously they're impacted, more than anyone, but there were the kids and the staff at the school at Mount Tabor, but there were kids and staff at other schools around the county. There were parents of kids school age around here with angst, and alumni around here that live here that are young professionals or adults now that were graduates of our local school system. And I think they all kind of have feelings and thoughts about what you see this on the news, but it happened here at home, right, in our own city. So a lot of parents, I've seen on social just expressing concern or angst. And I guess to start off with, how would you go about processing this or starting this conversation with your child? If your child was actually at Mount Tabor or even just at one of the other schools, many schools were locked down that day. How would we go about talking about this school shooting traumatic event to a child, to a kid?
Yeah, I think a lot of children and teens were affected by the school shooting. Those directly going to Mount Tabor, and also a lot of the community schools in Forsyth, I understand we're on lockdown. So, we have a range of ages from very young all the way up through teenage students who were affected by this trauma. So I think as a parent or caregiver, it's important to open up lines of communication with your child or teen. Ask them what they experienced during that time. Talk to them about their thoughts and feelings at the time and how they're doing right now. For older kids or kids who might be on social media, ask what they have heard or read about on social media and what their thoughts are about that. Make sure to be a good listener, just be a sounding board for them. Validate their feelings. They may have a range of different feelings about their experience, and provide some reassurance that parents, caregivers, school personnel, and law enforcement are working to keep them safe and trying to make sure that this type of event doesn't happen again in our school system.
That's good. That's a good foundation. You brought up the idea of social media. I thought there was all kinds of information flying around the day of the school shooting, and social media was the main communication channel, and some of the information was accurate, a lot of the information was not accurate. There were rumors, of course, that can fly around on social media. So
Yeah,
would you suggest, a good piece of advice would just be, if you see stuff on social media, it doesn't necessarily mean it's true, right? So don't. I know going down rabbit holes of what ifs can create additional anxiety, correct?
That's correct, Justin. I do think parents should be cognizant of what their children and teens are looking at on social media and what information they're getting. Parents can help to gently dispel any kind of rumors or misinformation that their children or teen might have about what's going on. I think social media can be really important for older kids and teens to stay connected socially, but it can also create some stress if children and teens are looking at content that may exacerbate their anxiety or they're getting misinformation. So there has to be a balance there.
True. Very true. You talked about lockdowns at a lot of the schools around the area right after the shooting. And this is personally with our kids. This is a conversation we had with our kids when they got home from school that evening. Is the lockdown procedure? What would you suggest, or how could we kind of help a child, a school age child who's experienced a school lockdown? How do we help them process through that if it wasn't necessarily a drill? I mean, it was a lockdown. How can we go about talking to them about this?
Yeah, I think that's important, to talk to your students about what that experience was like. Ask them what happened, ask them how they were feeling and what thoughts they were having, how teachers responded and what they were told, how other students responded. Really try to understand their experience and give them a chance to talk about that. You want to make sure to use developmentally appropriate language and explanations, especially for younger kids. You want to keep information more simple and to the point. It's always helpful to follow the child's lead and answer questions that they have for you. Also, you don't want to go into unnecessary or graphic details, especially for younger kids. So if they're not aware of some of the details already, you don't have to bring that up to them. And, some kids might have a lot of feelings about what happened. They might be feeling scared, especially, fearful at the time. They might be confused as to why this happened. So I think it's important to offer some explanations if they're confused. And for a younger kid, an example of something a parent or caregiver could say is something dangerous happened at another school. To keep you safe, your school was locked. Part of keeping kids safe is moving away from windows and into safe inside spaces.
Mm-hmm.
I know that might have been really scary for you. You did a good job being brave. Your school kept you and the other kids safe. It's safe to go back to school now. So just addressing what happened and addressing going back to school after this week.
Mm-hmm. Mm-hmm. Yeah, I know a lot of kids, students, youth, they might be having lots of feelings and thoughts about this, and helping process is great. Some of the kids might say, when you ask your teenager or your child how they're doing, you get I'm fine or fine. One of my kids is in middle school, so that's a common response I hear after school. How was today? Yeah, it's fine. And not really offering too much detail after that. But with something more serious like this, where there has been a serious incident, and there's lots of chatter among their peers. Um, some of it could be accurate chatter, some of it maybe not accurate. But maybe they say, "Well, I'm fine," but they
Mm-hmm.
don't look fine, or you don't think they're fine. What's the next step as a parent you could do?
Mm-hmm. Yeah, I think especially with middle schoolers and teenagers, that you may be more likely to get that kind of a response. Some kids and teens are going to need some time to process the events. They may not even be sure exactly how to talk about things, or maybe they haven't quite sorted out all their feelings about it yet, and they may need some additional time. And it's okay to give them that time. Um, Parents can let them know that they understand that their middle schooler or teen might not be ready to talk about things yet. Let them know that you're here to listen to them when they're ready to talk. Let them know you're going to keep checking in with them to see how they're doing, and you're always there to listen.
Mhm.
But some kids and teens may not want to confide in a parent. I think especially as kids get older and more independent, they may not want to rely on a parent, and they might be more comfortable talking to someone else.
Mhm.
So let them know that that's okay. Help them problem solve about other people they could talk with, such as a school counselor, a pastor, a family friend, and guide them in that way.
Yeah, that's a great point. I know, I've seen over the last several days, there's been several local churches around the area, offering that type of service with their youth pastor or with their counselor, just to listen
Mhm.
and be a sounding board and help process through. I think that's a good point, and I think Dr. Scoggin, who we've had on the podcast previously
Mhm.
as well, the big step is just to verbalize it, right? And that
Mhm.
helps put it into perspective if you can verbalize what you're thinking and feeling, and then put it in the context of what is the situation right now. That's just going through that step can be very helpful.
Mhm. Yeah, I think however kids and teens can start to express their feelings can be helpful. So whether it's talking to someone or writing, or some kids express themselves through music or artwork,
Hmm.
however is going to be the best way to help your child process what's happened and start to express themselves. I think you can explore those options with them.
Yeah, for sure. So I guess the next question I would have is, maybe your child or your teenager has expressed, that they're feeling, sad or afraid or anxious or angry even,
Hmm.
so the next step, how could we as parents help our child cope? What are some tangible coping skills that we can help our child utilize?
Hmm. Yeah, there are a number of ways that I think parents and caregivers can help their children cope with negative feelings. Keeping a structure and routine at home helps make things predictable,
Hmm.
and is a good way to start with coping. And then also encourage your child or teen to engage in positive self care behaviors. So make sure they're actually eating. Make sure that they're eating some healthy options. Encourage them to get to bed on time and try to get enough sleep. Make sure they have some physical activity scheduled in their days.
Hmm.
Encourage them to socialize with friends and engage in activities they enjoy doing.
Hmm.
Also, you can structure time together as a family, doing fun activities together.
Hmm. Yeah.
Distraction can be a helpful coping tool. We talked about limiting exposure to disturbing social media and news coverage. I think kids, and especially older kids and teens, are curious, but you don't want them, glued to the TV or social media, constantly exposed to material that might cause them to feel more anxious. You can help your children and teens learn relaxation strategies such as like belly breathing, mindfulness meditation. There's a lot of great apps out there now
Okay.
that assist with these. Also being aware of just thinking patterns. So when people are feeling anxious or angry or confused, they may have some unhelpful thoughts that might not be all the way true. And they can learn how to replace these thoughts with more helpful ways of thinking. So you can talk to them about that. Focusing on things that you're grateful for can also be a good coping tool. It can be beneficial to volunteer or help other people,
Hmm.
to help you cope with a difficult situation, and to help them feel safer at school too. I think parents can talk to them about, if something concerning happens at school or if they hear something concerning on social media, what can they do? Talking to a parent, letting the school know, communicating what they're seeing and hearing that might be a safety concern,
Hmm.
might make them feel like they have a little more control in the situation.
Gotcha. That makes sense. Those are definitely several good strategies. And, a, a child or teen might respond better to one versus the other. So I think, having these multiple different ways of helping with cope is
Hmm.
helpful. That, a child might respond better to one versus the other. So having several of them uh, to be able to try and help, I think is good. I'm glad you went through several of these different options for us.
Yeah, I think about it kind of like a coping toolkit.
Hmm.
So, certain kids or teens may gravitate towards particular ways of coping, and certain coping strategies may work better in some situations than others. So, having a range of options can be helpful.
Absolutely. I think I've already heard this, not necessarily in my own house, but just around online, around the community, that, some kids are a little worried about going back to school, right? So I think it's a
Hmm.
very real response for a child in our communities to say, I don't want to go back to school. There was, my school was on lockdown. I was scared. There were, lots of police showed up, and I didn't know what was going on necessarily. Or, I heard a rumor that something might happen to my school at some point later.
Mhm.
What should we do? Should we keep them out of school, or if so, how long? How can we walk
Mhm.
through that process?
Mhm. Yeah, I mean, I think it's a very real fear that many of our kids are experiencing right now. Um, part of trauma is avoidance. So if a child experienced trauma and negative emotions associated with the school shooting, it's natural for them not to want to go back into that environment and situation. Um, so I think it's on a case by case basis. Some kids and teens who have pre-existing anxiety and now have heightened anxiety might be having a harder time with coping with going back to school, or teens who were more directly exposed to the trauma might be having a hard time thinking about going back to school.
Hmm.
So I think there are those kids and teens who may need a little bit of time away from school, and it may not necessarily be helpful to force them to go back before they're ready. I think that the end goal is to go back to school. And I think the school system is doing a wonderful job of having resources available to families.
Hmm.
So I think if you're in that situation where your child is very adamant that they don't want to go back to school, and you are thinking it may not be in their best interest, you can always consult with the school counselor, your pediatrician, an outside counselor, perhaps, to find out what is in the best interest of the child, and what kind of plan makes sense, and come up with a plan that seems comfortable for everybody.
Yeah, that's good. That's helpful, Dr. Nicolotti. I appreciate it. And that's a good point too, that there's maybe parents don't know what they don't know, about resources that might be available to them. But just reach out to, a great place to start would be their school,
Mm-hmm.
counselor or school psychologist or school social worker. Um,
Mm-hmm.
I'm sure that they can help. This is another interesting thought, and I'm sure it's very relevant to some kids and teens in our area right now, that they might be having a hard time sleeping.
Mm-hmm.
We all know that good sleep patterns are very very healthy for us, and not sleeping can cause other issues. But if they're scared, or they're having nightmares or bad dreams, or just having a hard time going to sleep, what's some advice we can give our youth or our teens about
Mm-hmm.
this?
Yeah, after a trauma and as a response to anxiety, there's a lot of physiological hyperarousal, which makes it difficult to fall asleep. And nighttime, bedtime can be a particularly difficult time when there aren't other distractions happening. So I do think this is a pretty common response to trauma and anxiety provoking situations.
Hmm.
So, first of all, parents can encourage healthy sleep hygiene, such as just keeping a regular bedtime, having a calming bedtime routine, trying to avoid screens before bed.
That's a good one.
Um, Maybe adding some additional calming activities before bed. And if your child or teen is receptive to this, they may benefit from having some more time with you before bed just to connect and feel safe.
Mm-hmm.
Um, you can use distraction. Do diaphragmatic breathing before bed, do an enjoyable activity that doesn't involve screens before bed.
Mm-hmm.
um, Kids can be helped by thinking of calming thoughts or enjoyable thoughts before they go to sleep at night. So kind of setting an intention to think about something enjoyable, like a fun family vacation, or a fun extracurricular activity that they enjoy doing, and really cultivating thoughts around that to help them relax and be able to fall asleep. For worries that are really hard to control, you can encourage your child or teen to have maybe a 15-minute worry time that is not directly before bed. And that is a time where the child or teen can worry. They can think about all of their worries. They could write their worries down, maybe put them in a worry box. But at the end of that time, they try to stop thinking about them and save them for the next day. And this helps to compartmentalize the worry and anxiety, and hopefully allows for some more relaxation to fall asleep at night. Older kids may benefit from writing in a journal. So writing down, thoughts and feelings, again, a way of kind of expressing maybe some of those feelings that are disturbing to them.
Mm-hmm.
So those are all types of activities that might be helpful before bed and help with some sleep issues. And if sleep problems persist, it may be a good idea to check in with the primary care doctor, about any type of medication that could potentially be helpful.
Mm-hmm. Gotcha. We're talking about Dr. Nicolotti. We want to help parents as much as possible and give them as many tools in their toolbox to, be a parent or a caregiver, help process through, traumatic events such as a school shooting or having their school on lockdown.
Mm-hmm.
As we move in and move on and look at what could be some actual signs of acute stress disorder, or I guess help us understand what acute stress disorder is.
Mm-hmm.
Versus PTSD. I think a lot of us maybe have heard PTSD on TV, but help us dissect those two and how they could be affecting our children.
Mm-hmm. Yeah, first of all, it's normal to have a lot of negative emotions and some symptoms around experiencing a trauma. Acute stress disorder is a response to trauma that happens several days to up to a month after the trauma. Post-traumatic stress disorder is similar, in symptom presentation, but it's a longer term symptom. So acute stress disorder would be, within a month after the trauma, whereas PTSD would be longer than a month after the trauma. And some of these symptoms involve things like intrusive thoughts, memories, or images. So, a child or teen might, replay what happened to them in their mind and not be able to stop thinking about that. They may be experiencing persistent negative emotions and have more difficulty feeling positive emotions. They might be experiencing things like symptoms of physiological arousal. They might be hypervigilant, have an exaggerated startle response. They might startle really easily. They might find that, now they're having trouble concentrating on schoolwork or remembering things. Sleep difficulty can be part of the physiological arousal. They might find they're more irritable. So those kind of symptoms can be part of physiological arousal. They may also want to avoid, so I mentioned that before, they might want to avoid reminders of the traumatic event. So they might not want to go back to school. They might not want to go to places that remind them of the trauma. They might want to avoid people, places, thoughts, or feelings that are associated with the trauma. And that might be in part why some kids don't want to talk about feelings. Some kids and teens might also experience dissociative symptoms, such as like feeling that things are not real. or trouble, remembering some details of what happened during the traumatic event. So those can all be signs and symptoms of trauma exposure. And for many, I think these symptoms will remit over time. But if they don't, if they worsen, if they persist, if they are interfering with functioning and quality of life, then, that child or teen may benefit from more professional assistance.
Okay. So I guess to follow up on that, what are some of the warning signs we need to be looking out for regarding, our child's adjustment or lack thereof?
Mm-hmm. Yeah, in addition to the symptoms we talked about, sleep difficulties, we said it can be really common, or excessive sleep. Some kids might experience appetite changes. So you can look for, not eating, not being interested in eating, changes in mood. So could be more sadness or irritability, withdrawing, not wanting to spend time with family and friends. Especially for younger kids, you might see things like being more clingy, having some anxiety separating from parents, or also even regressive behavior where, maybe they're needing more help than they did in the past. We talked about how some kids might not want to go back to school. Some might have more difficulty even enjoying themselves or having fun, not being able to motivate themselves. If you start noticing declining grades or, just disinterested in doing homework and schoolwork, some kids are going to display more somatic symptoms like abdominal pain, headaches, those kind of symptoms. Some kids you might notice seem more worried or panicky. Some kids might have personality changes even. And for, adolescents and teens, be looking out for substance abuse or other type of risk-taking behavior. Any statements about self-harm should be taken really seriously as well.
Gotcha. Yeah, those are all good kind of signs we should be looking out for. I think we're Dr. Nicolotti, we're probably getting closer to the end of the podcast, but there's a couple of more questions I really want to get to, and I hope parents or caregivers or grandparents are really honing in and getting some good information that they can take away and use in their house with their kids. I think this is a question that is not necessarily specifically for a school shooting, but just traumatic events in general, whether it be a car accident or something, a drowning. But if a teen, especially a teen, lost a good friend, that friend passed away, and they're grieving the loss of that friend, being a teenager, they might not know how to process what they're feeling. How can we help them in that arena if we have that unfortunate situation?
Yeah, the loss of somebody important in their life can be one of the biggest stressors that they may experience. And, as an adolescent or teenager, they might not have all the coping resources to manage that on their own. It's important to recognize that, grief might involve a number of different symptoms and doesn't necessarily happen in a really linear fashion for everybody. It's a process that can take some time as well and changes over time. They might start off in shock or experiencing some numbness. They might have sadness, times of anger, feel confused, feel anxious. Some might even have feelings of guilt. It's important to create openings for your teen to talk and share feelings. Be a good listener, validate their feelings. But sometimes teens don't want to talk or they're not quite ready. And parents can help them explore other ways of coping that we talked about previously. You also want to encourage good self-care, because I think in times of grief, it's sometimes hard to focus on yourself and take care of yourself, but it's important to continue to do that. Having social connection with friends and family can also be helpful. Encourage consistent routines. So try to stay in a routine, try to stay involved with activities. But at the same time, if your teen is feeling overwhelmed, they may need to take a break from some optional activities for a little while. If your teen doesn't want to talk to you, maybe again, a school counselor or a pastor could be helpful through the grieving process. And assist your teen in finding ways to honor and remember the person who died.
Dr. Nicolotti, is very helpful. How do I know if my child might need professional counseling, and maybe work through if they're anxious about, that idea of professional counseling, but helping them put at ease how helpful it can be. It can be a great tool.
We talked about some of the risk factors to look for. But if symptoms are severe, if they persist for a long time, if they negatively affect the child or teen's health, if there seem to be decreased quality of life or interference with your child's ability to function in important life areas such as, school, family life, social life, or extracurricular activities, this may be a sign that more professional counseling can be helpful. So in those type of situations, you can talk to your primary care doctor or school counselor, or if you have access to an employee assistance program, they can help you locate appropriate services for your child or teen.
Gotcha. Yeah, that's very helpful, Dr. Nicolotti. As we wrap up this podcast on, helping kids cope with gun violence, as our community is still processing through the school shooting here in our own city. The parents are, the adults might have a hard time right now processing. So what can we do? How do I deal with my feelings as the grown up, right? I'm supposed to be the rock and the source of calmness and steadiness, but I'm having a hard time. What can I do myself?
Yeah, I really think a lot of parents experience trauma as well, during the aftermath of the school shooting. And I think the same advice that, I would give to kids and teens, I would give to parents. I think self-care is really important. And parents can really model this for their kids. And I think it's okay to give yourself permission to take care of yourself. I know sometimes parents feel like there's so much they need to do for their family and their children that it's hard to carve out that time. But I think it's important for parents. It's kind of the airplane analogy where you want to secure your own oxygen mask first before you secure the mask on your children. So you have to be, in a good state so that you can be supportive for your kids. So parents should really seek out support if they feel like that would be helpful from friends, or even professional services. It's normal for caregivers to experience a range of intense and negative emotions following a trauma. And that's okay. And, for older kids and teens, it's okay to share some of this with your kids in order to help them know that this is a normal feeling. You just want to make sure not to overburden them with your emotions. So there's the balance there. But I think, parents, just like kids and teens, need to do what they can to take care of themselves and ask for help and seek out resources.
Dr. Nicolotti, that's great advice. I think that's a good point. There's definitely a certain amount of self-care that needs to come into play, so that we can be better equipped and better prepared to help with our children and teenagers might be going through. So very important points that you shared with us. Yeah, I appreciate your time today. I know you've been busy, and but this has been such a impactful event in our community around here, and offering these tips and this great information for caregivers and parents on how we can help kids and teens deal with gun violence and cope with gun violence, and the feelings and emotions that come thereafter is very helpful. So I hope people listening today find it helpful as well. As we wrap up, what are some resources that you can help give us parents or caregivers in dealing with the aftermath of a school shooting?
There are a lot of good resources out there, and I believe some of our resources have actually been posted on the intranet site of Atrium Health Wake Forest Baptist, so you can look for them there. Going to the American Psychological Association website is one resource that may be helpful. They have a number of articles there about helping children and teens deal with gun violence.
Gotcha. Yeah, that's. I'm glad you mentioned the website. Right on the homepage of wakehealth.edu. I just want to let people know there's 2 phone numbers right there on the homepage. If you need help yourself or with your child or your teen, there's telehealth counseling services that you can get connected to. So there's a couple of phone numbers there, and that the webpage that you mentioned a second ago can be found at wakehealth.edu/coping with stress. And there's several resources on that page that hopefully people can find helpful as well. So, this is a unfortunate tragedy that happened in our community. But, like I said at the top of the podcast, I think, we're seeing, at least personally, I'll speak for myself, I'm seeing some hope and that the way the community is rallying together and supporting the Mount Tabor community, but just as our kids as a whole, and hopefully this podcast can just be one more source where people might find a little hope or some helpful information. So everyone listening, just to remind you, we've been talking with Dr. Linda Nicolotti. She's a section head for pediatric psychology and behavioral health here at Atrium Health Wake Forest Baptist. And Dr. Nicolotti, thank you so much for talking with us today.
Thanks for having me on, Justin.
Yes, ma'am. Everyone listening, thank you for taking the time. If you find this useful, please, as always, share it with a friend or family member. And until we chat again, please, I'll say, I usually say be well, but this time I'm going to say be kind and be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.